everyone. Welcome to another segment of our Mental Health Moments. I'm Linda Golick. I'm the Health and Wellbeing Strategist in Business and Community Health at Bellins Health. So thanks, everyone, for taking some time to take a little time for yourself today. What a gorgeous day we're having outside. So I hope that everybody's in a happy mood today because the days are getting longer, there's more daylight, all sorts of good things happening. So really excited to have another very special guest with us today. So we have Jody Anderson. Jody is our community engagement team leader, but she's also a certified youth and adult mental health first aid instructor. So she's going to join in our conversation today. And I also want to give Jody kudos because she's a part of planning these monthly segments. So very happy to have you with us, Jody.
I'm excited to be here.
And as always, we have Charles Latour, who is our licensed behavioral health therapist. So how are you today, Charles?
Really good. How are you doing, Linda?
Doing great, doing great. So thanks to both of you for taking the time. Oh, I'm sorry, did I interrupt you? Okay. So we always like to look at what our monthly Lifesaver Wellbeing topic is and talk a little bit about that. So this month, our topic was Slow It, Don't Blow It. And what we were really examining was the impact that busyness can have on our health, specifically our mental health. So any feedback from the two of you as far as that goes? Charles, I'll start with you.
Sure. I think busyness is at the root of a lot of what we deal with in the way of mental health, and sometimes can get in the way of mental health as much as anything else. A number of years ago, a writer that I really like, he's out of Harvard. I'll hold up this book if we could see it. Crazy Busy. His name is Ed Hollowell. He actually goes by Ned, but Edward Hollowell at Harvard wrote this book. The subtitle to it, I think, is something a lot of people can relate to: Overstretched, Overbooked, and About to Snap: Strategies for Handling Your Fast-Paced Life. So there's a number of different things in this book that I think are helpful and interesting. One of the most notable ones that I've found people can understand, gravitate to, and identify with is what he describes as two distinct types of functioning. One is functioning in F state and C state. C state is the state that we're calm, cool, collected, curious, consistent, creative, a lot of things that function at a high level. And when we're in that, we're in a pretty regulated state and feeling pretty good. We found this great rhythm in life. Busyness, the things that we do, the extreme schedules that we're sometimes dealing with, can lead to F state, which is frenzied, frantic, forgetful, flailing, furious, frustrated, flustered, all of those type of things that can lead us to feel dysregulated and not in the greatest rhythm. So when we have the busyness of our life sometimes taking us to there without even knowing it, we need some mindfulness to kind of course correct and get us back into that C state. So we could talk about that a little bit more. Jody, anything you'd like to highlight in this busyness that we're all experiencing?
Well, I'll just say, guilty as charged. I have been in the F state quite a bit lately, and I think it's just important to be transparent about that. I'm so excited to see people joining here every month for Mental Health Moments, because it just clues me into the fact that, people want to learn more. People want to learn more about how to get out of that F state and into the C state. So joining us today and having these conversations and doing some self-exploration is a great place to start.
Thanks for that, Jody, and I'm right there with you. So thanks for speaking to me too, Charles, because I think we tend to get into that mode. So it's so great to have that awareness and work to get out of that. So what's really exciting is that the month of May is actually Mental Health Awareness Month. So we really want to spend some time really learning around that, bringing some awareness to that topic. And again, that's why we have Jody as our special guest today. So she will add to our conversation. So Jody, the first thing I really wanted to talk about, because I was fortunate enough to go through your mental health first aid training about a month ago, and one of the things that really struck me was the idea of the language that we use and how important that is. Can you tell our audience a little bit more about that?
I just feel so strongly that language matters, especially when talking about mental health. You know, you mentioned, Linda, that May is Mental Health Month. And I'm thinking, you know, why isn't every month Mental Health Month, right? We have to just kind of shift our thinking. And when we use language that we're used to, things that we hear on the street, I mean, I could pose it to the group here that we have today. You know, when you're talking with your friends and families, or even in your office space, start to think about what are some of the words that you hear that might describe a mental health problem. So I'd like to just quick do an impromptu exercise here, and it's called a chatterfall, kind of like a waterfall. And what we'll have everybody do is you can type in, but don't hit send until I count down. And what I'd like you to think about are, what are those words or phrases that you hear every day, you know, even on the radio or in social media, in your office space or even in your homes, that are used to describe people who are suffering from a mental health problem? What are some of those slang terms? Don't be afraid to put those into the chat, but I'm just going to give you a couple seconds to formulate those in your head, or maybe even get ready typing those in. And then I'm going to count down, not yet, on the count of 3, 2, 1, I'll have you hit enter. So on your mark, 3, 2, 1, enter. Let's see what floods the chat.
A lot of things we have. So we have crazy, insane, challenged. I'm so OCD about this. Scared. Crazy again, losing your mind. Sick. Dingbat. Nutcase. Cray-cray. Impaired. Weak. Yeah, and those are some really strong terms.
Very strong terms. And think about it this way. If you were to hear those phrases, and maybe you yourself were struggling with a mental health problem. I mean, I myself suffer from anxiety and sometimes panic. And if I were to hear these phrases out in the community or in my workspace, would I be more or less likely to get help? And that's one of the things that we're going to talk about today, and why mental health first aid is so important. So just think to yourselves, the group today, would you be more or less likely to seek help if you were hearing these phrases spoken about mental health problems?
And that's really part of our goal today, is to really to reduce the stigma surrounding mental health. You know, we want people reaching out and getting that help when they need it, whether it's physical help or mental help, and we want to reduce that stigma. So hopefully our conversation will help do that today. So I really want to move into the importance of early intervention. You know, we think about when we hurt ourselves physically, sometimes how important it is to get into that doctor early, right, before it causes more damage. How does that same method really apply to mental health? Charles, and I'll start with you.
I think it's the exact same message. I don't think there's any difference at all. You've heard me say that the day that we can treat our mental health the same way or with the same consistency we do our physical health, we will be healthier. But I see people all the time delay, put off, whether it's a couple who in their marriage, they might have some things not working that well, and other times feel that things are okay. And I'm not saying that the minute we have an argument, we got to go to marital therapy. I'm not saying the second we have some anxiety, we need to go to individual therapy. I don't mean it that way. But I find people day in and day out coming into the office at the last stage. It's the last ditch effort. The last thing I will do before this, the seriousness of it, that, and people tell me this all the time. For years, I've been wanting to do this, or for months, or for weeks, or for as long as I can remember. and I put it off. I put it off until my husband was ready to leave me, or my wife ready to leave me, or my son was ready to get thrown out of school, or I was on the brink of this. We put it off way too long. And then secondly, the treatment can be more difficult, possibly even more lengthy, more costly, so on and so forth. So just like any other aspect of our health, the earlier intervention, the better we are.
Jody, what would you like to add to that?
Yeah, I just think it's really relatable to even a physical health problem. So just as Charles mentioned, early intervention is important, especially on that road to recovery. And if a person, for instance, has a broken bone, what happens if they don't go in to get it checked or x-rayed or even set? It can lead to problems. It can lead to a loss of function. It can lead to a disability. So that same concept applies to mental health. And we always want to encourage people getting early intervention because that means they're on that road to recovery.
Awesome. So I did say earlier how we really want to reduce the stigma around mental health. And I think, that's part of our goal with this series is to make these very normal conversations. Let's be having these conversations about mental health, having them with our coworkers, our friends, our family. What else do the two of you think we need to do to really reduce that stigma, to really just normalize these conversations around mental health? Charles, I'll start with you.
Yeah, I think part of the one thing we can do is to be able to, as well as we can, educate. What I find is the more proactive we are in educating and helping people understand that having a mental health issue, you wouldn't feel ashamed if you did break your elbow, like Jody's saying, or I had an injury, right? And we wouldn't feel if we had another illness that there was something with us that was problematic. But because of this stigma that we're talking about and all of these names that people identified, I saw some of them. I can never really read all of these, but a couple that jumped out. We don't say there's something wrong with someone if they have diabetes, that you're psycho. But we say that when someone feels that they're struggling. I was just talking with someone yesterday that told me their husband thought they were psycho for needing to talk to somebody. So there's a feeling of weakness, inadequacy, lowered self-esteem, sense of disempowerment. And I think that's the message that, from an educational standpoint, we have to turn around. It isn't a sign of weakness to ask for help. Secondly, the education around there's this great strength in finally being able to, especially if you put it off for a while, facing a fear that you had and actually walking through the door to sit down and talk to someone about it. That can be empowering rather than disempowering, that this is what you are doing for yourself. So rather than seeing it, thinking about it, the perspective of this is weak, there's something wrong with you, how could you need help? We wouldn't say we need to repair a broken leg on our own. We wouldn't say we need to repair diabetes on our own. We wouldn't say we need to address so many physical issues on our own, but some of the ones that are more invisible, that's what we tell ourselves. But when we could get the message out that not doing it on your own doesn't mean anything is wrong with you, it means that you are smartly empowering yourself to utilize the best resources available to you, people professionally trained to do this. It's one of the best things you can do for yourself rather than a sign of weakness.
I wholeheartedly, yeah, I agree. And I just love some of the phrases that you're using, Charles, seeing this as a strength, empowerment, rather than getting over something, you're getting through it. And what does that look like on the other side? How much stronger are you for going through it and getting the help that you needed?
I think the other thing that comes to mind for me too, when I think about this, when I've encouraged people in my life to seek some kind of assistance for something they were going through, I always think of it this way. Nobody is an expert in everything, right? Like, we go to the dentist to to get our teeth worked on because they're the experts. We have an accountant do our taxes because they're the expert. We go to somebody to maybe change our oil because, you know, or fix our car because that's their area of expertise. So I think if we think of it that way, like this is someone's area of expertise. This is stuff that they may have been dealing with as their job for years and years, and they can give us a different perspective than maybe we've ever seen. So that's how I like to normalize it too for myself. So in terms of really where to seek help, you know, how do we know that we do indeed need help, and how do we go about that? How do we know if someone around us, you know, really needs help, or we ourselves need help? Jody, I'll start with you.
Well, I kind of want to just circle back to, you know, mental health first aid and why it's so important. So mental health first aid is really that initial help. So it'd be interesting, just type in the chat real quickly, if anybody who is CPR certified, just flood the chat. 3, 2, 1. Let's see how many people. Yeah, a lot of people are certified in CPR. So just like, you know, CPR doesn't teach you how to do heart surgery or, you know, how to do anything like that, how to do bypass surgery or even prescribe medications. It's that initial help. It's that initial help that has an action plan. It teaches you what to do when somebody is struggling with their heart. So just like that, mental health first aid is that initial help for somebody who may be struggling with a mental health problem or a substance abuse problem, and getting them to the care that they need. And what the skills that are taught in mental health first aid, it's an action plan. So just like CPR teaches you compressions, the airway, breathing, the action plan for mental health first aid is a 5-step plan, and it teaches you how to assess for risk of suicide or harm. So prior to that assessment, you're thinking and you're noticing some things. We call them our noticing skills are increased. So, you know, what are those things that might be going on in a person who might be struggling with a mental health problem? The next step is listening non-judgmentally. I think we could probably all agree that listening is definitely a skill. And then adding that non-judgmental listening piece to it is so important, especially for somebody who might not feel heard or somebody that might not feel that they understand what their symptoms are. The next step is giving reassurance and information, encouraging appropriate professional help, and then encouraging self-help and other support strategies. So the program itself, again, is just that initial help. It teaches an action plan, and then it covers a lot of the common mental health problems that, you know, we hear about today, like depression and anxiety. We talk about PTSD and some eating disorders, bipolar disorder. We talk about all of those things. We learn about the signs and symptoms, and then we really dive in to that action plan. So getting into going through some scenarios about how to help somebody. And when you pose the question about, you know, seeking help, as a mental health first aider, we're really seeking out, you know, what are those signs and symptoms that somebody might be showing? What am I hearing as I'm listening non-judgmentally? And then what are my next steps? How am I going to get this person to the help that they need? And maybe it's just a matter of encouraging self-help. We could all use a little bit more self-help.
Thanks for that, Jody. I think, you know, the training was just such a great awareness tool. There's just so many things that we don't necessarily pay attention to, and that training really just helps you just to open your eyes about looking for things, being more understanding, and those types of things. Charles, what would you like to add about how do people know, you know, when to get help or how to see it in others around them?
Well, first of all, I just want to say I've been through Jody's program too, in terms of actually being part of seeing her and co-presenting with her. And the program is unbelievable and incredibly rich with information, resources, and so forth. So, and Jody's been doing some incredibly great work with it. So as far as treatment and, you know, what I'm encouraging people to do all the time, and I see it on the receiving end, so then I'm encouraging it on the preventative end, is know yourself, be honest with yourself. Sometimes the honest look in the mirror is what it comes down to. The thing that I find, if I was going to lump it into one area, and this is going to be very unfortunate, I wish it wasn't this way, but just in the direction of honesty and transparency, what I've found for people when they're ready to get treatment is, I don't know if I want to do this anymore. Feeling the way I'm feeling. In fact, I can't keep doing this. So sometimes it comes down to a forcing function of pain. Something where I can't feel this way anymore, and I don't want to anymore, and it's now time for me to do something about it. Real change often doesn't happen until we reach that point in our life where we need the forcing function for that to happen. Short of that, getting feedback from family, friends, peers, having the difficult conversations, I'm noticing this, maybe this would be helpful. Those sorts of things are things family members can do. But when someone themselves is really ready for change, it usually is a result or a byproduct of, I'm at the point where I really can't do this anymore.
Absolutely. And each person really just does have to determine that for themselves. But I think another kind of good tip in there is, talking to your friends and family. Hey, do I seem, and they may be enough to reach out to you too, but do I seem off? Do I seem like I'm different, and those types of things? Judy, I wanted to touch on, one of the things that I thought was really helpful from the mental health first aid training was that idea of that awkward conversation. And I think that is even maybe a helpful tool for those that are on our call today. Tell us about that awkward conversation and how all of us can be more aware of what we can do.
Well, I'm sure all of us here have had, a similar situation where maybe you're walking down the hallway, going to get a cup of coffee, and it's those brief interactions where you're like, oh, hey, how's it going? How was your weekend? And you almost, when you ask that question, you might have the expectation that the person is just going to say, oh, it was great, fine, whatever, how was your weekend? But are we really prepared when somebody says, I'm not doing well, I'm having a terrible day? Like I'm really at my tipping point. Are we ourselves prepared to respond to that? And oftentimes it really feels awkward. It feels awkward. We don't know what to say, or maybe we're taken by surprise, or like, I didn't ask for that type of response. But I would encourage that self-reflection, like, am I prepared for those awkward conversations? And am I available? Am I emotionally available to be there to listen and say, like, what's up? What's going on? Or I noticed that you're kind of down today. What's going on with that? So it's just really keeping that door open. And that's one of the things as a mental health first aider, we share that, you might not always be the right person at the right time, but somebody might reach out to you in the future, just knowing that you took that step to have that awkward conversation.
Charlie, do you have any recommendations on that? When we notice somebody maybe isn't doing so well, or they are having that bad day, what can we say? How can we be of assistance in those situations?
Well, it's really, to me, there's a couple different really key elements to it. One is to know each other, communicate, your relationship, particularly work. When you see someone is done, I call it kind of jokingly, but with a seriousness to it, the rule of 180. When someone seems to be a total 180 from what they're typically like, casually mentioning, hey, I've noticed this. You might not even have to say you're worried, but I'm really interested. If you'd like to talk, I'd love to be able to talk more about what's going on. You may have to generate it. When it's a family member, you might have to do the same thing. I've noticed this. I've been wondering about this. It might not be anything, but I just was wondering. If there's something that you would like to talk about, I want you to know that I'm here. Something that's reaching out, care in a caring way, supportive way, not accusatory, not threatening, not even challenging, but it's I'm noticing this and I'd like to know if there's anything I could do. Help me understand in any way that I could help. Anything along those lines is going to help a difficult or awkward conversation move forward. So, and we're challenged in all of that right now. So I was talking to someone recently saying, I don't feel I have nearly the pulse on my team that I did when we all worked together. When we're right down the hall, or you'd see somebody 10 times during the course of a day, even if it was just walking by, that you could notice those nuances and subtleties of how they're doing. Without that, now we almost have to be more inquisitive, more inviting, going out of our way to do those subtle check-ins with our team, to be able to keep involved and let them know that we care.
And it is a little bit more challenging with people working from home, and maybe you're not passing those folks in the hallway, and maybe we do need to be a little bit more intentional and reach out to people. Exactly. Or structure things where we're having conversations solely for the purpose of how is everybody doing. And I think we were a little bit more aware of that when COVID first was starting, like, oh, let's check in and let's make sure that people are doing okay. But it is really something that we need to be doing all the time. It isn't just a COVID-related issue. It's mental health is just like broken bones. It can happen. It can happen to anyone at any time. Yeah. So it's just something
Can I say something, Linda? I think I want to double click on that. What you were saying is so incredibly great. This environment has created the term a lot of people are using for it. It was happening before this, but this has made it even more an issue. And it's the difference between interactions and transactions. This COVID has actually made formats of video and so forth much more transactional. Interactions have been minimized, transactions maximized. Meetings that maybe would have taken 30 minutes are now just the quick 5 minutes, just give me what we need and move on. The quick transaction, very little in the way of peer-to-peer interaction. I describe it as if you go to the bank, you don't go to the bank for anything other than to make a withdrawal, make a deposit, and then we're done, right? We don't go in just for a conversation. It's just this transaction, and then we're out of there. Our work life has become more like that. The busier we get, it's just the quick transactions. What do we need? That piece of information. And because we're not in a room communicating and having those subtle check-ins before everybody is even there, like we may have been a year and a half ago, where we might be able to say those things, hey, I'm doing so bad, or, how are you doing? We don't get to do that. So those interactions have almost been completely negated, transactions highlighted, and then we're done. So the part that you were saying, the intentionality needed to be more interactive is greater than ever. And we have to do more of that to overcome this transactional thing that we've grown into. So that's what I wanted to double click on.
I love it. I just want to add, with the pandemic and everything that it's posed, and I just noticed, like, oh, my door is closed to the office, and even having a door closed in a setting where you're used to hearing voices or seeing people walk by kind of creates that barrier. It creates that connection with other people. I know many people feel that masks also create that disconnection. You're not seeing people's facial expressions. I love having these WebEx calls or the Zoom calls, even FaceTime. I know a lot of people like to text, and sometimes it's hard to utilize your noticing skills during texting unless you really are familiar with that person. So I encourage people to make those phone calls so that they can hear their voice. You're picking up on some of these verbal cues. during those conversations. And I just want to give a shout out to Elizabeth in that how she took a proactive approach to touching base with a person on a weekly basis, whether they need it or not. It's just a nice way to have those check-ins before things could potentially be going the wrong direction.
And I think it kind of equates back to also with Elizabeth's mention of, you know, enhancing it and keeping those healthy interactions going. It makes me think about how when we want to take care of our bodies, we have to continually do things again and again and again, right? It's not the one push-up that does it. It's doing the one push-up again, again. Well, that's the same thing with mental health, and it's the same thing with knowing people and getting connected to people. You don't just build a connection in one day. You have to repeatedly work on it. And so if we can all be more intentional of connecting to each other and checking in on each other and really noticing, like, hey, I noticed maybe something's a little off today, really taking the time to have those conversations, I think that's where some really significant things can happen. So really, really great stuff. So I do want to talk about resources because we're talking about, you know, people reaching out for help if they feel like they need it. Maybe they're ready to take that step. What can they do? Where can they go? What are some of the things that you see getting in the way sometimes with some of that? And Charles, I'll start with you on that. Where should people start?
Well, oftentimes their starting point is dictated by either their issue or their whatever they have a benefits plan and so forth. But generally speaking, so with that as the caveat, generally speaking, depending on degree of severity, right? If it's a major incident and there's possibly suicidal ideation, Brown County has some really great resources. There's an inpatient hospitalization. There's the Brown County crisis line. If someone's in immediate crisis, that's where you want to go. The other end of the extreme, sometimes called the worried well, doing great, functioning at a high level, but I do have these worries in my life that are impacting me, and now is the time to do something with it. EAP is a great entryway into the mental health process and into the mental health experience. Typically 6 sessions or less, and that's all that person would need. So that's a great resource. For ongoing individual outpatient psychotherapy, the Bellins system, whether it's for medication or psychotherapy and so forth, I regard it as the best around. If it's something a little bit more intense, maybe Bellin inpatient treatment, the hospitalization for acute treatment is available as well. So those would be just a handful of things that I would encourage people when examining themselves, what they might want to do next would be a starting point for some of those type of situations.
How about from you, Jody? What do you think are some other resources that can be helpful to people, or where they can start?
Well, because it's Mental Health Month, every year Mental Health America puts out a new toolkit. And within that toolkit, there's activities and resources and worksheets. You can download it, you can print it, whatever you need to do. I've been downloading that for several years just because it's got so many great ideas. And every year they have a new theme. So they're providing people the tools and the resources to explore for themselves and explore for others. And I think, you know, it's important to do some self-exploration and to practice self-care. We know that, you know, the pandemic has really made mental health definitely a challenge, and we know that people are struggling. So doing things like learning about, you know, becoming more self-aware and then learning about how you can help others. I think the mental health first aid program for either youth or adults, or now they have a teen program in schools, is a great way to start. It helps to teach people, again, this action plan, and it teaches you how to really feel empowered to help others who might be struggling. And I want to give a shout out to a couple community partners that I see jumped on the call. Here at Bellin, we have Roland Schmidt and Eric Langus, who have become new mental health first aid instructors for youth. And we have another instructor up in the north, Marla May, and I often partner with my very good friend, Rebecca Fairman from Connections for Mental Wellness. And there's just a lot of really great community partnerships that we can form when encouraging others to learn more about mental health and be able to help others.
Perfect. Thank you for that. So yeah, lots of great resources, both in our community and online. I had downloaded the Mental Health America Toolkit, and there were just some really great handouts in here. And I think even in your workplaces, you could distribute these via email, or you could hang them up on bulletin boards. I mean, there's just a wealth of information, and there's good visual, colorful, pieces that I think people will really enjoy taking the time to read. And Maureen put a link in the chat. Fantastic. Thanks for that, Maureen. Thank you. Well, I do want to open it up for any questions. If you have questions for any of us, myself, Charles, Jody, please put those in the chat. And again, Maureen put the link to that mental health kit, so you can go out and download that, and lots of great information within that kit. Maureen is also reminding us that wear green on May 19th for Mental Health Month. So we'll all mark our calendars to wear green, May 19th. Thank you for that. Well, as we wait for some questions to come in, I just kind of want to get your final thoughts today. So, Charles, any final thoughts as far as mental health awareness goes and everything that we've talked about today?
I have several. So yes, so one of them is, it ties in a little bit to what you were saying earlier in the sense of what we do every day matters. I think I always like the line, when we take care of the minutes, the years take care of themselves. So mental health isn't a once a month thing. It isn't a once a year thing, like on October 10th. When we take care of the minutes, the years take care of themselves. So the more mindfully we live, the better we take care of ourselves, and that we can treat how we take care of our mind similarly to the way we take care of our body, we're better off. And the more preventative we are, the better we are as well. So with that, I want to tell a quick story which kind of highlights this preventative thing that I'm describing. So in a book called Upstream by Dan Heath, if anybody's familiar with it, it's the idea of understanding some things before they even become problematic. So the book starts out with this parable of two friends picnicking on the side of the river, and they see a young person floating down the river in trauma, arms flailing, so they jump in and rescue the kid from the river, right? A minute later, just as they're tending to this person to safety, the same thing happens. They jump in again, rescue the person, get there, provide safety. The same thing happens again. They jump in the river, take the person out, and at this point, one of the friends starts walking away. And the other friend says, wait a minute, where are you going? Look what's happening, you can't leave now. He said, I'm not. I'm going upstream to find the guy throwing these kids in the river. So it's kind of like when we could be proactive, when we could be preventative, not just in the moment, but being ahead, taking care of ourselves as well as we can. A lot of the tools that we've talked about in programs similar to this, but being aware of our own self-help and our intention to being the best version of ourselves, mindfully and intentionally, we are on the road to being the best us that we can be.
Perfect. Thank you for that, Charles. Awesome words of wisdom. How about for you, Jody? Parting words today?
No, I love that example, Charles, of upstreamism. And I think really that's where we're trying to go in healthcare. We know that prevention is really the best intervention, right? We are trying to create systems of health and well-being, and that includes mental well-being. So making sure that we're doing our own part of practicing self-care, practicing your noticing skills with other people, exploring resources that we shared today. It's all part of the plan to, again, be our best selves.
Beautiful. Thank you so much for that. So I did have one question that came in from someone. It said, what would our speakers suggest if they have someone who is concerned about trying therapy or counseling, but they're concerned about finding the right professional fit? Advice for choosing a person to meet with. Any thoughts on that? How do you find the right fit?
You want to go first, Jody, or you want me to?
I was going to leave that up to you, Charles.
Okay, good. So first of all, whoever put that forth in the way of a question, it's great. And many people, that is one of the biggest struggles. For one thing, the reason I'm saying it's such a great question, period, is there's a lot of research that tells us the fit alone is therapeutic, right? It isn't just how much a person knows. It isn't just how equipped they are, or even if it's their type of practice is perfect for your type of issue. Oftentimes it can come down to fit. So, but there may not be a guarantee. We're a lot better now than we were a number of years ago, and that's one of the benefits of the computer and so forth. We could say more about ourselves as clinicians, but sometimes I've seen many people over the years that have been with one, then moved on to another, then another, and they say, I've never found a great fit, I've never found the right fit. So it's like looking at their websites, their bios, their skill sets, their interests. So you want to at least make sure that topically you're matched up well. Secondly, issue-wise to skill set, you're matched up well. Oftentimes, someone will not want to see a male, only a female, or vice versa. So that's part of it. And then other times you cannot tell unless you get in there and find until those first couple minutes how it was, and sometimes even a few sessions. But there's no guarantees ahead of time, but there are some things that you can do in the way of your own homework and due diligence to at least have a working fundamental level of knowledge about who you're sitting in the office with. And these days, I'm amazed at what people, for example, know about me before we even have introduced ourselves. It's just incredible. So there's things that we can do, but you may never know for sure until you give it a try.
And I think it's okay, too, that if you're not feeling the fit, if that isn't a connection for you, that's okay. And Charles wouldn't be offended. Another therapist probably will not be offended if you look for a better fit for yourself.
Yeah, and sometimes we may even do that. Like, wow, it sounds like this. You thought this would be great, but I know somebody who does so much of this and it's become their specialty. So we will always tell them at the beginning of a session, we'll offer you any additional treatment that might be warranted. Or if there's a better alternative than talking with me, I will even tell you that. So yeah, there's never a problem if it isn't the ideal fit for you.
Great. Thank you so much for that. So I don't see any other questions today, so I guess we'll kind of wrap up our session today, but great thanks to Charles and Jody. Jody, thank you so much for joining us today and sharing all your knowledge with us and for helping us plan these sessions. And as always, Charles, thank you for all of your time, because we know you are busy seeing a lot of those patients. And so thank you for taking the time to feed all of us and to help all of us keep our mental health really at the forefront of what we strive to continue to improve on. So that will wrap us up for today. Thank you again to all of you for joining us. Please join us again next month. I'll be sending out this recording, and then look for future invitations. Have a great rest of the day, everyone.
Thanks, everyone.
Thank you.